Have you ever experienced severe abdominal pain after eating? It could be. Here's how to tell the difference. Hey there, Dr. James from Pancreatic Cancer Warriors here. Today, we're comparing two deadly pancreas conditions because confusing them costs lives. Let's dive in and uncover the crucial differences that could save you or someone you love. Imagine waking up with intense stomach pain. Is it just a bad case of indigestion or something more sinister? When it comes to pancreatitis and pancreatic cancer, knowing the difference is vital. It's the kind of pain that makes you double over. But pancreatic cancer, it's sneakier, a dull, persistent ache that worsens over weeks. But there's one red flag you can't ignore. Think gallstones or one-to-many nights at the bar. But pancreatic cancer, it's like a silent assassin, developing without any obvious cause. That's why I always stress, if there's any doubt, get imaging done. It could be the difference between life and death. That's why it's so dangerous by the time you notice. It might be too late. Have you ever wondered why these conditions get mixed up so often? But here's where you need to put on your detective hat. It's because our pancreas is like the shy kid in class. It doesn't make a fuss until things get really bad. It's like your pancreas decided to throw a tantrum out of nowhere. Pancreatic cancer, on the other hand, is the master of disguise. Regular checkups and imaging can help ensure nothing more serious is developing. Remember, your health is in your hands. Don't be afraid to ask questions or seek a second opinion if something doesn't feel right. Maintaining a healthy weight, eating a balanced diet, rich in fruits and vegetables, limiting alcohol, and not smoking can all help reduce your risk for both conditions. Chronic stress can wreak havoc on your body, including your pancreas. Finding healthy ways to cope with stress, whether it's through exercise, meditation, or talking to a therapist, can have far-reaching benefits for your overall health. It's about making small, consistent choices for your health every day. Earlier stage pancreatic cancer is often treatable, sometimes even curable. Subscribe to Pancreatic Cancer Warriors. We refighting medical myths daily and arming you with the facts you need to stay healthy. Together, we can make a difference in the fight against pancreatic diseases. Trust your instincts and seek medical advice. It's always better to be safe than sorry. You could save a life, maybe even your own. But knowledge is power. By understanding the signs and differences, you're arming yourself with the tools to catch it early, if it ever does occur. By understanding the differences between pancreatitis and pancreatic cancer, you're not just protecting yourself, you're becoming an advocate for your health and the health of those around you. But because it's so often confused with other conditions, many people don't get diagnosed until it's advanced. That's why understanding these differences isn't just interesting. Every year, thousands of lives are affected by pancreatic conditions. Behind every statistic is a person, a family, a story. By spreading awareness and understanding, we can change those stories. We can catch cancer earlier, treat pancreatitis more effectively, and save lives. It creeps up on you, symptoms building so gradually you might not notice at first. By then, the symptoms can look similar on the surface. Notice your skin or eyes turning yellow. That almost always points to cancer. It's a warning sign your body's screaming at you to pay attention to. It's the kind of pain you might brush off at first, but it doesn't go away. Acute pancreatitis usually resolves within a few days with proper treatment. A diet high in processed meats and low in fruits and vegetables might tip the scales towards pancreatic cancer. Family history plays a bigger role in cancer risk too. Chronic pancreatitis can flare up repeatedly, but between episodes, you might feel okay. Pancreatic cancer, its symptoms are relentless, getting worse over time without letting up. Let's start with pain. Pancreatitis hits you like a freight train's sudden, burning pain that radiates to your back. Now, here's where it gets tricky. Both conditions can cause weight loss and nausea. So what's causing all this trouble? Pancreatitis often has clear triggers. In pancreatitis, certain enzymes like amylase and lipase skyrocket. It's like your pancreas is sending out an SOS. But for cancer, we need to look deeper. CT scans and mysteries can reveal tumors hiding in your pancreas. How do doctors tell them apart? Blood tests are your first line of defense. Here is a shocking statistic that keeps me up at night. Up to 30% of pancreatic cancers are initially misdiagnosed as pancreatitis. That's nearly 1 in 3 cases. Can you imagine the precious time lost thinking you're dealing with one condition when it's actually another? This confusion isn't just frustrating, it's deadly. Treating cancer as if it's pancreatitis wastes valuable time. Every day counts when you're fighting pancreatic cancer. Let's break this down further. Think about it. Both pancreatitis and pancreatic cancer can make you lose your appetite. You might find yourself dropping pounds without trying. Nausea becomes your unwelcome companion. With pancreatitis, the onset is often dramatic. One day you're fine, the next you're in agony. Here's another key difference: how long the symptoms last. Let's talk about risk factors. Both conditions share some common ground. Smoking and heavy alcohol use can increase your risk for either, but there are some distinctions. Now, imagine catching pancreatic cancer early. It could change everything. Here's a critical point. If you've been diagnosed with especially if it's chronic or recurrent, stay vigilant. Let's address the elephant in the room. It's natural to worry about cancer, especially one as serious as pancreatic cancer. What about prevention? While you can't completely eliminate your risk, there are steps you can take. Here's something that might surprise you. Stress management plays a role too. Now, let's circle back to why this matters so much. Remember, your body is constantly communicating with you. Learning to listen and understand those signals is crucial. If something feels off, don't ignore it. As we wrap up, I want to leave you with this thought. Knowledge is your most powerful weapon in the fight against pancreatic diseases. So, what's your next step? Share this information with your friends and family. Remember, your health is in your hands. Stay informed, stay vigilant, and never hesitate to speak up about your concerns.